Good morning. How are
We're good. We're going to go live in about 50 seconds.
you? Okay, awesome.
We tried to stall as long as we could in that break, but just keep
Yes, thank you. Let me just grab a few other links here while you're doing that.
All righty. What prizes did you give away the other day?
We did 3 health executive checkups.
Oh, wow.
Nice.
Yeah, they're a nice deal.
That is a nice deal.
So very exciting stuff.
Have you had one of those?
I feel like I haven't, but clearly I need to.
You should. I recently had one of those. Need to do a 50,000 mile checkup.
50,000 mile.
And oil change.
That's
It's important.
like the Rolling Stones. They used to go and get like blood transfusions every year.
Hold on. Here we go.
Big news. I have some important news for you.
Interesting news.
It's Blake and Darren's Spilling the Tea with Sandy.
K-Man's top news headlines of the day from CMR.
Good morning, Sandy.
Good morning, Bobo.
Bobo.
How are you?
We are good.
How's it going?
Awesome. Everything's
What
good.
headlines you got for us?
His Excellency the Governor and the Deputy Governor issued a joint statement yesterday saying that they essentially support the Premier's decision in relation to Minister Bush, and just reminding all MPs of the importance to ensure that they do not interfere with the civil service in any way, and that they follow just good governance and keep the provisions of the Constitution in mind when carrying out their duties. So the governor made a statement about the importance of the separation of powers.
Mm-hmm.
So,
Alrighty.
yeah. The business grant and stipend programs have resumed. So if you are a small or micro business or even a medium-sized business that could use an additional injection, the government is essentially giving you money if you meet certain criteria. So yes, you have to meet criteria, and they're rolling out this. They did it during the sort of height of the pandemic back in 2020, and now they are continuing it as people, obviously companies start to slowly emerge out of the COVID, downturn in the economy.
Mhm.
So 19-year-old Liam Bolgen has been recognized by the Ministry of Tourism for his outstanding achievement of receiving the highest mark in the world for the Cambridge International Examinations A level in travel and tourism for 2021. So
Excellent.
congratulations to Liam. Well done. Cuba. If you want to travel to Cuba, you can now do so with no restrictions in place, as Cuba has lifted all requirements as it relates to pre-arrival testing and quarantining. So now you can go and jump off the plane and just have yourself a good old time in Cuba.
Havana. Unana.
Yeah. And finally, there's some Caymanian dancers who are going overseas with your help. 5 Caymanian young ladies are heading to a program in Harlem that is well recognized, but they need the public's assistance to be able to get there. So they've been accepted into the program, and they're hopeful. They're called Dream Chasers Cayman, and they're hopeful that they get the necessary funding to attend the Harlem School of Dance Summer Intensive Program. And we wish them all the best of luck, and we're sure that after people hear this, they'll get all the donations that they need.
That's good.
Yeah, excellent.
Yeah, absolutely. And just FYI, mask mandates are beginning to return some places in the US.
Mm-hmm.
So, yeah. I know everybody thought, just throw the mask away. We're done with that.
It's Blake and Darren's
But
Spilling.
apparently not quite yet. It's still good advice, even if it's not mandatory, to wear a mask. And research has shown that the category that's more likely to wear a mask are actually vaccinated people, which is kind of interesting.
Yeah.
They're just more compliant people, I think.
Yeah.
It's some states in the U.S. like Philadelphia,
Yes.
one of the cities, is doing that. Some of the colleges are doing that
Mhm.
Mhm.
as just a precaution. It's the BA2 variant. that's seeing an increase.
Yeah. Which will make it here if it's not already.
Oh, I think it's here.
Is it?
Yeah. So those are your news headlines this morning.
All right, catch Sandy in 2 minutes on Bobo 89.1 FM. We'll see you tomorrow.
Have a fabulous day.
You too. Bye.
Bye. All right, folks, let's kick it off here in just a second. I'm going to get all of my links and stuff together. While we're doing that, let's enjoy a little beloved Al Cayman. As you guys can see, if you're on the live stream, I'm actually sweating because our thermostat for the studio isn't working. So I need to go and do a manual adjustment on that. So give me 1 second and I'll get that done.
Peppermint, sorrel, ginger, fever grass, or English. Get it ready. Your morning tea just got hotter.
Ooh, honey child.
On the cold, hard truth. Bobo 89.1 and Cayman's #1 talk show are bringing you morning talk like no one else. Monday Rewind, Impact Wednesdays, Caribbean Connections, and much more. Don't miss a beat with what's happening in the local community. Just keep sipping your tea.
What a mess.
Here's your host, live and direct from the Cayman Islands, Sandy Hill.
Cayman, rise and shine. Happy Tuesday. It is April the 12th. We're heading into the Easter holidays. I think a lot of you actually have kids that are out of school this week. And of course, Friday is Good Friday, and this is the upcoming Easter weekend. So good morning to Virtuous Panook. We have Marshall joining us from North Carolina. Miss Elizabeth is on the live stream, says Buenos Dias. Do not forget, folks, 936-2626 is the show number. You can certainly join us at any time. Good morning to Louis. Louis is joining us from Detroit. He's another Caymanian abroad. And he says, CMR massive at home and abroad. Good morning, Miss Brenda. Where have you been? We've missed you. Brenda Archer on the live stream. Good to see you. Louis says, happy Tuesday. Felicia's got it locked. Miss Emma is coming out. She says, about Cuba, go and catch COVID and bring it back to Cayman. All these Russians are still traveling there. So be prepared. Well, I think everybody should be prepared. Not just the Russians are probably spreading it, but everybody. Someone I know that went there tested Sunday and was negative, but it was positive today. Yeah, I mean, unfortunately, you're still taking a chance when you travel, folks. This is the realities of it. It was like over the Christmas holidays. Pretty much everyone that I knew that went to Jamaica and came back positive, because Jamaica has a very high rate of, I think like over 70% of their population over the holidays was COVID positive. That's a lot of people. And, you know, they continue to struggle with their numbers. They've had thousands of deaths. So, yeah, that's all over the world, though. So Cuba will undoubtedly be no exception at all. Let me see, their deaths on April the 11th, they reported, that was yesterday, they reported 14 deaths. The 7-day average is 3. So 14 in the last 24 hours. Wow. Huh. So yeah, you know, it's crazy. Folks, this virus worldwide has killed over 6 million people and infected over 500 million. And believe me when I tell you that statistically, those numbers are underrated. That's just how it is. Good morning, Evelyn. Debbie's got it locked. Good morning, Catherine. Stephen is joining us from the UK. Good morning to Mr. Dale. Wee Wee's got it locked. Blissful Powell is also here. She says, good morning, CMR family. Miss Bonnie joining us from East End. Miss Bonnie, I hope you had a wonderful birthday weekend. And we will be having Health City joining us for another rundown segment. So don't forget, folks, if you won your free health checkup last week, don't forget to, I think I've sent 2 names. I'm trying to remember who the third person was. So if you've not heard from me regarding that, please do reach out so we can make sure that Health City has your information. And they will certainly be in touch about booking your executive checkup, which we're going to be getting into all the details about that this morning. So Richard, good morning to you. Hope you're doing well. Damien says, so Cuba has a different variant. Worry about Cuba. Worry about China, sorry. And Fauci. Well, listen, it is what it is. There will be variants that will continue to emerge all over the world. And I did think that it was interesting that just 5 weeks after lifting their mask mandates, and where was that, Philadelphia, they're returning. You see, you know when your parents used to say to you, don't follow fashion. You know, if your friends jump off a cliff, are you going to jump off too? And you looked at your parents and used to think, yeah, that sounds like fun if my friends did it. Sometimes you got to take a step back and you've got to remember that, just take your time. So the city of Philadelphia is going to reinstate an indoor mask mandate. So they're the first U.S. city to do so this spring, just 5 weeks after they were dropped. Seems like a complete waste of dropping it to me. Vaccinated people are more likely to wear a mask than unvaccinated people. And you know what was so interesting about this is it is a significant amount. It was like unvaccinated people are more likely to wear a mask 20-something% of the time. And vaccinated people, it was like 70, almost 80%. And I think that it says something, I believe, about the mindset of people who've taken the time to get vaccinated. They are just more likely to be compliant individuals, generally speaking. So, they're going to wash their hands, they're going to wear masks, they're going to do all these things. And probably a lot of the unvaccinated are still those people who don't believe that COVID even exists. So they're still fighting like it doesn't exist. Ooh, my aunt just died of it, but it still doesn't exist. So they're still very much fighting the whole concept of COVID, although we've had over 6 million people now that have died from this. And that's probably why they refuse to protect themselves. They refuse to protect other people from it as well. So it's very interesting. When I read that, I thought, for me, that makes a lot of sense, honestly, that they would be the least compliant people when it comes to just general precautions. Interesting. All right. So what else is making news headlines? Well, this morning we have to express our condolences to the family of Mr. Graham Thompson. He passed away at the age of 84 in Honduras. You guys will know him from Graham's Place, and he was just an icon there in Guanaja and beyond. So a lot of Caymanians were extending their condolences to Ken Thompson and the rest of the family yesterday for sure. 84 years old. Yeah, he did well. And I understand, I did not personally know him, but I understand he was an absolutely wonderful person. And so, we know that he was sick for a little while, and we just want to extend our condolences to the entire Thompson family. So we've got a keen listener this morning who said, don't forget to send out the links to all the WhatsApp people. A lot of them sit by and they wait for me to send the links before they click on the live stream. But, we're here every morning, YouTube and Facebook, Monday through Friday. And of course, Bobo 89.1, 936-2626, my apologies, is the telephone number. So I dropped our call-in jingle yesterday, and a lot of people loved it. They're like, Sandy, you got to play that more often. And I'm like, that jingle is at least probably a year old. But yeah, we don't play it a whole lot. But yeah, I'll play it more often. Good morning, Hero Blair says, yes, we all need to protect ourselves. That's for sure. Good morning to Miss Sue. Amelia's got it locked. She says, have a blessed day in the Lord. Good morning to Dawn. She says, what the old people used to say is ears can't hear, but ask and feel. Yes, indeed. In some form or another, they would say that. Good morning to Jonathan. He says, this is just the beginning of the viruses. I hear the bird flu is going to make a big comeback. Well, Jonathan, the truth of the matter is we've always had viruses, the Spanish flu 100 years ago, over 100 years ago. And so I think that we just went a really long time without one that was massive enough to impact the entire world at the rate and speed that COVID did. But, it certainly makes us think twice about how viruses can transmit so easily in this day and age. It's a lot harder to contain them. Even the Spanish flu, it was spread by, the men who were at war, because they were really the ones who were traveling all over Europe and bringing it back to different locations. So, yeah. Good morning to Miss Beulah. Good morning to Donovan. All right, so in other news headlines this morning, we did have 2 men who went missing last night at sea. And I want to give a big shout out to the Cayman Islands Coast Guard, the RCIPS, and private boaters who really stepped up to assist in the rescue and recovery of these 2 men. It seemed like it was a bit touch and go for a minute there. One man was actually brought in, I think, quite quickly. They found him. And then the other individual was, the boat was just starting to, it's a 14-foot boat, not very big. And it was starting to really go off course. And there were some concerns that as they continued to search into the night, that this was going to get far worse. But thankfully, he was found, it looks like, based on my messages, after 11 o'clock going into the midnight hour. So, thank goodness for that, because as you guys are well aware, the longer someone stays out there and the more they drift, that's a problem. So at some point, the boat had lost engine power and it was drifting in the CUC vicinity. And then they actually end up finding him in West Bay at the Holiday Inn. That's where it had started to drift. So both the Coast Guard, the helicopter, and fire rescue had gone out. The call went to 911 from 6:45 p.m. So, they were in distress from that time. And the helicopter was not up until 11:05. So I did have people messaging me saying, why did it take so long for the helicopter to get up there? That's 6:45 to 11:05 is quite a few hours. So I do not have the answers immediately to that, but we will reach out to the Commissioner of Police and make some inquiries in terms of, why that was, because, that's a lot of time. And that's the whole benefit of having this high-tech helicopter, is that it can be deployed quickly, and in especially rescue situations, it can give the Coast Guard and private boaters a fix on the actual location of, where the individuals are at. So I'm lucky for Jesse and his companion who were out and got in a little bit of trouble. So, the word was that the boat had capsized and that Jesse was missing, but then they found one guy swimming, and then the other one, he was still drifting with the boat. So a happy ending is something that we're all celebrating today. But, even when we have happy endings, folks, there are lessons that we can certainly learn from this. So, yeah. All right, folks. So just remember that we are, I see somebody messaging me about calling. Okay. So I'm not sure if they're trying to call on the show now. I'm a little bit confused by the messages. So 936, during this time, we can only make calls that are show related, obviously. So 5 Caymanian dancers, these young ladies are doing a fabulous job. I want to congratulate them. They have been accepted into a Harlem dance program this summer in New York. It's a summer intensive program, which means that they're going to be learning a lot. And I really want the community to get behind these young ladies. They need some funding to be able to make this dream a reality. First of all, it is difficult enough to get into a lot of these programs because you're competing with people all over the world. And so when the Cayman Islands is put on the map by accepting not just one, but 5 of these beautiful young ladies, I want to say that, it is our responsibility to chip in whenever we can and to help them to get there. So this is fantastic. These young ladies have been performing and they've sent us some of their dance routines and information. And we posted it up on the website in case you missed it. Go check it out. And they have an opportunity to be involved in this program where undoubtedly they will really elevate their skill set. And so we want to encourage anyone who's interested. We'll post something, separate post on the website on our social media platforms this morning. But if you're interested in supporting young talent, look at these beautiful Caymanian faces from the Georgetown area, and they have all been accepted into this program. So I want to invite you all out to please go out and even if it's, $25, $50 here and there, everything adds up, folks. So it's the Harlem School of Dance Summer Intensive Program. It's Peyton Morrison, Malika Morrison, Mia Pita, Gianna Gregory, and Cassidy Davis Quintero, and they are dancers. And they have an opportunity now to go to this program. And basically their hard work and their discipline has really paid off. The name of their group or the organization that is helping them go is Dream Chasers Cayman. And this is definitely a big dream. And they said that it feels great coming from a tiny little island, jumping into this big opportunity. And these girls have worked extremely hard and deserve it. So Dream Chasers Cayman is actually a dance company that was established in 2017. And the company has grown tremendously. And I think this is wonderful that these young ladies have the opportunity now to go to the Harlem School of Dance. And it is considered, a wonderful program. So we want to, again, support them in any way. You can contact caymandreamchasers@gmail.com or 938-4610 if you'd like to make a donation. And in the story, by the way, there's a beautiful video of these young ladies and their performances. So if we get a chance a bit later on, we'll play that for you. Yeah, wonderful. All right. Yes. Okay. Wonderful. All right. So again, donations needed. Give these young ladies a call. caymandreamchasers@gmail.com. Congratulations, ladies. Well done. Very, very proud of you. All right. Who else do we have joining the show this morning? We've got Robert. Good morning, Robert. I don't know. It looks like we have a little spammer this morning. Tim, we don't allow spammers on the morning show, so we block and delete you. Sorry. Bye-bye. Elizabeth says, just thankful that they're alive. Good work, uniform crew. Up, up. Good morning, Dr. Tahir. I think we are, without a doubt, Dr. Tahir's favorite thing to do in the morning is watch the Cold Hard Truth because he's always here. Like so many more of you. So Diamond Princess is also here. Louis says, radio communication, does someone constantly monitor the frequency? Maritime emergency channels. I would think so, that there are people who are doing that. But more importantly, I think most people travel with a mobile phone, even when they go out on a boat. So presumably they're able to call in on their mobile phones and let people know that they're in some sort of distress. A lot of these really small boats, someone actually sent me a photo of the boat. It is super tiny. And I think that a lot of These small boats don't have all of the equipment on board that they should, which makes it a little bit more challenging if they get in trouble. And so, yeah, as a result of that, that's problematic. Right. Okay, so we do have Health City waiting. I think we have one more person that's going to be joining them here shortly, and then we're going to dive into a bit of a conversation with them in terms of what's going on. Shamari, if you want to get started first before the good doctor shows up, because I know he's very busy, we can certainly do that. Just give me the thumbs up. Or shall we wait? Let me just double check. All right. Check out our daily CMR Daily Buzz with Misha. You can get all of your headline news every single evening. That goes up on the website, and you can also find it on our social media platforms. Again, congratulations to Liam Bulgin. All righty. Okay. Oh, yes. All right. Let us welcome Shamari to the program. Good morning, Shamari.
Good morning. How are you?
How are you? I was sitting there waiting to see if we had anyone else joining us.
Yeah,
And
Dr. Sandy,
everything I messaged
unfortunately,
you.
yeah, he had an urgent case that he had to run into. You know, doctors being doctors.
Yes.
And obviously that's the most important thing right now. So you are stuck with me.
No worries. No worries. There's far worse things I could be stuck with. So good morning. Good morning to you, Shamari. Thank you so much for joining us this morning for a medical rundown segment with Health City. So first of all, Health City has been doing a lot of wonderful things, folks. So we're going to take a moment to have a look at some of the things that they've been doing because they've been extremely busy and they are celebrating their 8th anniversary. And there's a lot of expansion and a lot of growth happening at their facility.
Welcome to Health City Cayman Islands, where it's our mission to deliver world-class healthcare that is both accessible and affordable. Health City Cayman Islands is the Narayana Health Group's first hospital outside of India. The vision of the famed Dr. Devi Shetty, Health City is built on his premise that a solution is only a solution if it's affordable. Opened in April 2014, Health City in a short 6 years has become the preeminent healthcare brand in the Caribbean and is now seen as competition to even the largest health facilities in the United States, especially South Florida. In 2016, Health City really made its mark by treating international patients from over 60 different countries around the globe. Patients from near and far are reassured by the hospital's commitment to quality and safety. Health City Cayman Islands is the sole facility accredited by Joint Commission International in the Cayman Islands and is only the second hospital in the entire Caribbean region to receive JCI accreditation. At Health City, we also have a deep organizational commitment to superior outcomes. Our physicians and surgeons are highly skilled with several years of specialized medical experience. Indeed, our quality measures meet or exceed those of the most prominent hospitals in the United States and elsewhere. We have a record of taking on difficult, unique, and challenging cases with exceptionally positive results. And in the hospital's 6 years of operation, our doctors have racked up an impressive list of medical firsts and milestones for the Cayman Islands, and indeed the Caribbean region as a whole. Our team is dedicated to a culture of care because we know it's all about the total patient experience. We strive to exceed the expectations of our patients and their loved ones. Patients throughout the Americas and beyond have been drawn to Health City both for our overall vision and the ability to offer tertiary level care for a fraction of the cost in other markets, most notably the USA. Our ability to do this is newsworthy and has been reported on by major international news outlets. But beyond media reports and accolades, the true measure of our success is the opinions and experiences of our patients. They really say it best and let us know how much it really means to them.
I couldn't have ever gotten anything more than I got. I'm amazingly pleased with my care. I'm a vascular surgeon at home, so I see plenty of patients after cardiac surgery, and my care, my recovery, in my opinion, was as good or better than anyone I've ever seen. I'm very impressed with this. In fact, our company will consider sending some of our patients here for their care.
In addition to the care we give our patients, one of the things we are most proud of is how we give back. In our first 5 years in operation, we provided life-saving surgery to over 500 children through working with international and local charities as part of our pediatric heart surgery program. Locally, we are committed to investing in Cayman's youth today in order to develop the doctors of tomorrow. To date, our Healthcare Explorers education program has offered over 6,500 free STEM education opportunities to students in the Cayman Islands. And further expansion of our footprint, medical services, and educational opportunities is planned as per the original vision and mission of Health City Cayman Islands.
We had a very clear vision, what exactly we wanted this health city to become. We wanted to build a center of excellence for Western Hemisphere, wherein we do the cutting edge work where doctors from other parts of the world come here to learn. And we want to set new benchmark about delivering cutting edge healthcare. And we believe if there is one country where we can make it happen, that is Cayman Island.
In short, we will continue to transform healthcare and to change lives both locally and internationally. Our founder, Dr. Debbie Shetty, best summed up our future plans and prospects.
This is just the beginning and the best is yet to come. Thank you very much.
All right, folks, welcome back. Shamari, that's quite an introduction to, not only the vision of what Health City was meant to be, but also the fulfillment of that vision and the wonderful things that you guys are doing. So this morning, we want to focus on your executive health check. So last week, we saw a little glimpse into, your 8th year anniversary and a bit more about the health checks and what was being offered. So it's wonderful now to have an opportunity to get into some of the details, because I know some people are like, well, what's included in the health check? And, what do I get? And so now we're going to do just that. We're going to give everyone, folks, all of the details of exactly what an executive health check's involved. And there's actually more than one type of executive health check. So we will go through all of those in detail. So give us just a bit of an overview as to why people should really take on the concept of doing an annual, I guess is the best way to do this, executive health check.
Definitely, Sandra. And just to state that you would have seen the video that was an overview of Health City, what the vision was, what we have done, and a little bit of where we're going. And last week, if people tuned in, they would have seen the Camana Bay and the radiotherapy for cancer care that will be coming. So we're just proud to be able to fill all of the major gaps from a healthcare perspective in the Cayman Islands, just so that we can match being a first world nation, we can match having all of the levels of healthcare here on island. So you'll never have to fly overseas again. You'll be able to take care of everything closer to you at home with your family and friends as well. Now, Health City and everything you would have seen in the video is a lot of what we would do if you have an issue post heart attack, post stroke. And obviously we have all the latest technology as well as the array of high quality physicians to be able to take care of you. But now our executive health check program, is the preventative. This is the checkup to make sure, if you have that car and if you are taking that yearly servicing, what happens after 3 or 4 or 5 years, the car becomes deteriorated to a point where it takes a lot more money to get it back to where it needs to be. And that's why you have to constantly have checkups. So we just use that analogy because what our health check is supposed to do is identify the risk of future disease,
Mhm.
as well as to create a personalized program to help you improve your health if you currently have an issue. Um, as an example, and I know cancer is a scary thing at times, but if you actually catch cancers when they're in their stage one, when they're in their infancy,
Mhm.
you have a 70 to 80% chance to cure it and to become as healthy as you were previously. Now,
Mm.
obviously, as the stages progress, those
Mhm.
percentages become less and less. So it's very important. There was actually 1 day of our health executive checks that we caught 4 cancers in the early stages.
Mhm.
4. So it just shows you
Wow.
that as people come through and as we do the blood checks and various checks, we're able to catch things, as well as for the most part, we're also able to say, all right, here are your numbers.
Mhm.
Here are the numbers that are where they need to be, and here is the roadmap. And we have dietitians that will give you advice as well as meal plans. Obviously the physicians will tell you about the exercise, and it just needs to be
Mhm.
30 minutes, 3 to 5 times a week, 3 at the lower end, 5
Mhm.
at the higher end, but just 30 minutes of physical activity in order to also help to be healthy. And we're here with you for that journey. And with Health City, we just want to make sure with our executive health packages, there are various levels that you can
Mhm.
actually take. The comprehensive is the one that gets you. Well, I know everybody always sees the treadmill and would associate
Mhm.
that with the health check, just to
Mhm.
make sure that we can tell when you're under a little bit of stress, to make sure that everything is firing away at as it should be. Um, and during our anniversary, last year, I mean, last week, wow, last week we gave away some free health checks.
Yes.
But just reminding persons that for our anniversary, our comprehensive health checks are going for 500 US, which
Mhm.
means if you have insurance, your wellness benefit typically would cover that. So there would be no out of pocket for you to come, do your annual check, ensure you know your numbers, ensure that, get the peace of mind that everything is okay. And if it isn't, and we're catching it at the beginning phase, we can say, all right, you need
Mhm.
to watch this, come back and see me in 3 months and 6 months, 9 months to make sure you're back on track. Or if you're purely healthy, just go ahead and say, you know what, we'll see you again next year.
Mhm.
So Health City offers the full array, and by us having the multidisciplinary team that we do have at Health City, the
Mhm.
great news actually is that if there is something that we need to investigate further, we have the physicians for it. If, God forbid, we see that there may be an issue, we have an array of physicians that will look at it and give you the best options moving forward.
Mm. And Jennifer makes the point here that early detection saves lives. So, folks, we want to make sure that you can call into the program 936-2626. I think that this concept of early detection and really understanding the importance of an executive health check becoming part of your annual routine is really, really important. So, we know that as we get older, even some younger folks, there are things that they could have caught in their 20s or 30s had they thought, you know what, I need to start doing annual examinations, just making sure the heart is good, checking blood pressure, because some of these, sort of lifestyle related diseases are things that we acquire even when we're younger. So there are people who are in their 20s and 30s who can have aneurysms, who can have strokes, who can have high blood pressure and other issues. Sometimes there might be a hereditary factor at play, as well as a lot of times it's just our lifestyle or just luck of the draw. And there are times that, a really, really significant health risk is caught simply by going into the doctor. I've heard of so many amazing stories where someone just like, oh, I'm just going to go and get a health check done. And the doctor says, wow, this is something that we need to further test. I think of some really major examples, even here in our small community, where people didn't know that they had a serious illness, but something felt just a bit off. And they decided to go in for an executive health check. So I think making it a routine habit is a very, very good idea. And I like the fact that it covers a variety of different areas. So it is screening for conditions related to the heart, the liver. You can tell us, Shamar, you can go into a bit more details about what the screening includes. And then I do have, I'll share it here with our viewers online so that they can see what the different options are in terms of the executive options as well. So we can have a look at all of these. But do tell us, Shamari, what are some of the screening that will be included in the executive health checks?
Oh, definitely. So we will have the full blood screening, just to, as you mentioned, heart, liver, kidneys. So there's a liver function panel, kidney function panel, uric acid, thyroid panel. So the full array of tests will be conducted just to
Mhm,
good understanding and a good view of what your health looks like. Now, obviously, when we actually do get Dr. Sandeep on here, he'll be able to go into much more detail. But what
mhm,
we can state is, as an example, you would have seen the gentleman in the video, Dr. Leon Joseph,
mm,
who would have stated that he's a vascular surgeon back home, and
mhm,
that was been back home in Boston. He was a picture of health for a mature gentleman. He wasn't overweight. He exercised almost every day.
mhm,
Obviously, he was a surgeon, always using his brain function, and he never would have thought anything was wrong with him. But doctors,
mhm,
being doctors, sometimes neglect to actually check themselves, even
mm,
though he was the picture of health, and he was on a
mhm.
treadmill here at a local hospital. I'm sorry, at a local hotel, and had a heart attack
Wow.
and had 2 or 3 instances where they had to revive him
Mm,
prior to getting to us. And his nurse actually was his wife actually was a nurse by training. And
mhm,
when she saw the level of expertise from our doctors and our nurses, there was an
mhm,
option to air ambulance him back to the US, obviously to his health facility for them to do the surgery. And she said, we won't get anything better than what we have here. And potentially, this is better than anything I would have seen in the US. I'm making the call that we're doing the surgery here. And he said
mhm,
she made the absolutely perfect call, and that helped to save his life. But I
mm.
only mentioned that those are the worst case scenarios where Health
Right.
City can help you. However, he himself should have been doing those yearly checkups, which he
Mm,
neglected. Being busy and also doing everything he should have done, exercising, eating well. He was able to identify it, and it just shows you that you may see people, and everybody knows this case. You see somebody who looks like they're the picture perfect, uh, aim of what you would want from a health perspective, and then hear that
mhm,
something tragic happened or they had an incident, and you wonder, wow, why? But that's why
mhm,
you need the
mhm.
health check, and that's why we convince everybody to come and get the health check. And
Yes.
Sandy, I know we have a few
Some
testimonials.
testimonials.
So I would
Yes.
love to play one now so that people can see that persons in the community, what their thoughts are. And everybody that we would play would have done our health check more than once. And some,
Mhm.
probably 3 out of 4, I know, actually do it annually.
All right. So let's have a view, folks, of some of the testimonials.
My name is Marcus Cumber, and I am delighted to talk about Health City. As I get older, I'm now over 50 years old. It's important that I have an executive medical every year. And there's no one else that I'd rather choose in Health City. They went through my results, they went through the procedure, they answered all my questions, they put me at comfort, and I just felt like I was being cared for. Every time I go back, they know me by name, they always welcome me, and I will always use Health City.
So
All right,
that,
folks. So that's a testimonial.
yeah, and that's somebody that
From,
is well known. And
yes.
prior to Health City, he would have gone overseas.
Right.
And that's the other thing, Sandy, in that our even if you're paying out of pocket, our executive health check is a fraction of what you would pay um, at a like facility in the US. It ranges
Mhm.
at times anywhere from $2,000 to $4,000 to be able to do
Mhm.
the same level of health check that we're offering for under $1,000 or with additional benefit, 1,100 and I think 99 dollars. And these are all US prices.
Mhm.
So obviously people can convert that with 20% less. And the
Mhm.
great news is, as I mentioned before, info at healthcity.ky or 640-404, and just let them know that you were listening and you heard about the special for the health
Mhm.
check on CMR and you would like to take advantage of it, and you'll be able to get the discount that for our anniversary present, as I should say, that we
Yes,
have
beautiful.
for you.
All right,
Now,
so Marissa says, just to
yes.
read a few comments, she says, very good to know. I did it, and they're so professional with their checks. El Rey says that if you have a family history of heart disease and you're male over 40, I highly recommend that you get the calcium score test done.
Yes.
Hmm, interesting.
Yes. So
Okay.
the CT calcium scoring is
Mhm.
part of a part of the
Cardiac
comprehensive with the
executive.
cardiac, yeah, the cardiac
Yes.
executive, and that's just to make sure that all of the arteries and everything are pumping and not
Mhm.
becoming less and less able to allow the blood flow through, which obviously when it becomes restricted is how you get heart attacks
Mhm.
and the such. So we have the executive health check for 699. We have the comprehensive executive health check, which is the one that a lot of our persons who come through between the comprehensive and the
Mhm.
cardiac are two top packages that people actually come to Health City for.
Right. So I guess the basic executive health check has quite a bit of stuff in it. So you've got a complete blood count. So you do the CBC, the A1C. Now I know that that's related to um, diabetic and sugar levels over a period of time. Is that right? That's the A1C, I
Correct.
believe.
Yes. Yes.
Yes. Because that's for myself personally, that's the number that I've been told to keep an eye on because the thing about your sugar levels is you can go in the morning, take a sugar test, that's perfectly fine, but that A1C gives you a longer period of like a snapshot over 3 months of kind of how it's doing over the long term. So make sure, folks, that you include that one for sure. But this is all included in the very basic package. You've got lipid fats profile. So this is all the cholesterol stuff, which is really, really important because, of course, your cholesterol levels, not just the total number, but I'm glad that they actually have a breakdown of the HDL and the LDL. Now, this is the good versus the bad cholesterol and the actual ratio of good to bad, which is quite significant as well.
Sandy, you sound like Dr. Sandy.
I, you know what? Life has made me had to learn about these things because a lot of people do not know. But I actually had an ex-husband who had a family of heart disease in his family.
Okay.
And
Okay.
yeah, his dad just one day died of a massive heart attack. And the grandfather one day died of a massive heart attack. And so when I found that out, I said to my husband, he was always my ex-husband, he was, very active and fit and whatever. And I said, maybe we need to go and just do like a basic blood test and cholesterol levels. And funny enough, he had very high cholesterol and it had to be maintained. It seems like there was a hereditary factor. And it definitely had to be maintained by with medication because, diet helps, but he had to be in such a regimented diet that a lot of times it was very, very difficult to maintain that level. So medication certainly helped. But I learned a lot about,
Right.
cholesterol and triglycerides and the importance of the ratio. And so, yeah, that's an area that I'm a little bit of a nerd in. Yeah.
What does Sandy not know? Okay. But I, I'm
Yes.
I'm happy that you know a lot about this as well. But that's why this program is also important. So even for
Mhm.
persons who will not understand, obviously, what all of the different um, tests and what mean. That's why we have physicians that will be
Mhm.
there to also discuss what's going to happen, as well as on the back end to you have a portfolio that explains exactly what all of your results mean, and whether or not you need to change one or two things in your dietary habits, etc.,
Mhm.
all towards being healthier and ensuring that you don't have any major issues in the near to medium future.
Yes. So, folks, the basic one also includes a liver function panel, which is really, really important, kidney function, the uric acid. I mean, these are very, very comprehensive exams, I must say. A urine examination, you get the ECG included, the chest x-ray, and then of course the physician consultant who undoubtedly will go through all of these details with you. So every package that you then do after that, Shamari, just to
Correct.
ensure that I'm understanding it. So if I do
Includes
the
all of that.
cardiac, includes all of that plus. Right.
Correct.
Wonderful. So Al Ray has recommended the basically the cardiac executive health check, which includes the CT calcium scoring, which is looking a little bit more at the heart, as well as an echocardiogram, which again delves into examining the function of the heart a little bit more. So that's quite impressive there.
Right. And as you would see, Sandy, the comprehensive executive health check includes all of the tests that you were speaking about
Hmm.
previously, as well as the treadmill testing for the cardiac,
Hmm.
abdominal ultrasound. And then for men, you get the PSA. And then for women, you get the pap smear and the pelvic exam. And then you also get the diet consultation with the nutritionist to
Hmm.
ensure that they're, you may be doing the right things and they'll confirm it,
Hmm.
or they may say you need to, you know portion control, and or eat more veggies, and or eat more fruits because it contains X, Y, and Z, and based on
Hmm.
what we're seeing, this is what you actually need in your diet.
Right.
But one thing I can tell you, they will always say 30 minutes of exercise at least 3 to 5 times a week.
Yes, I need to get back on that wagon for sure. I've fallen off. And it's hard to listen. When you fall hard. I must
Yes.
tell you. It is challenging to get back. But you mentioned earlier that it doesn't have to be anything that's like, I don't have to run out there and run a marathon.
No.
It could be light exercise. It could be, just walking around the neighborhood. Um,
Correct.
you know,
Not like my
or
son strolling though, but yeah, you know, picking up
a
the pace a little
brisk
bit.
walk.
Brisk walk, yes,
Yes, a
yes.
brisk walk. And then, of course, you can do sort of bolt on or add on options as well to any of the packages. Tell us a little bit about what those options are.
Right. So, what one good thing about actually meeting with the physician as well is that they will be able to tell you, just based on your history, family history, and such,
Hmm.
whether they would suggest any of these add on packages. There's sometimes when persons come and they ask for add on packages, and after doing the evaluation, the physician will say, you actually don't need that.
Mm.
Um, so you can have a look. I know you have it on the screen, but we have tumor markers, hepatitis, bone health
Hmm.
screening, diabetic screening, respiratory screening, STD screening, pelvic screening, and myocardial screening as well. But as I mentioned, when you come in and you speak to the physician, if it's recommended, we will help you to understand which, if any, of those screenings you actually do need. And the great news is throughout the year, once again, we just want to make it accessible to the community.
Hmm.
We'll be doing various promotions. And we had a promotion, for instance, that had to do for smokers, where we were
Hmm.
going ahead and giving respiratory screening for persons who are heavy smokers, just to ensure that everything is okay, and then obviously to give some advice if they so would like that advice. But there were certain criteria you had to meet in regards to the numbers of years you were smoking, the number of packs that you may have been smoking, or number of cigarettes, I should say, that you would have been smoking in any given day, as well as your age and the such, in order to qualify for that type of screening. So throughout the
Hmm.
year, we will be doing various screenings in order to ensure that persons are able to access healthcare and to understand if there are issues so that we can help earlier versus waiting until it's
Mhm.
a little bit later and then it becomes more difficult.
Of course. Now, of course, smoking is one of those preventable habits that if you can kick it, the better off you'll be because it impacts a lot of different, sort of health markers in your life, everything from your cancer risk to obviously heart disease and other things. So if you can give up the habit, professionals are there to assist you as much as possible. So reach out to them. There are, I think, interventions that they can give you as well. So the one that I'm happy to also see on here, Shamari, for women in particular, is not just the Pap smear, but also the I just saw it. Now, where did I
The
see
pelvic
that?
exam?
The CA 125.
Okay.
Yes. So, a lot of women I find don't know about the importance of everybody, they push the pap smear a lot. So most of us know to do a pap smear exam, but we don't think about the CA 125, which is actually important for ovarian cancer. So that's another cancer that women need to be cognizant of. And along with that is included the pelvic ultrasound. So I think this is fantastic. Some really good tests here. STD screening. So you've got venereal disease screening, HIV screening, only $60. And again, if you're sexually active folks, this is one that you should add on as a standard, bolt on as far as I'm concerned. I was just speaking to Noel Cayasso over the weekend from the Cayman Islands AIDS Foundation, and he was saying how a lot of people do not know their current status as it relates to just generally speaking, those types of diseases, and in particular, the big one being HIV. So make sure you know your status, folks, and again, make it an annual exam that you're well informed about.
And Sandy, once again, I'm so happy you're here because you're doing Dr. Sandeep's job. Um, we might have to borrow you and take you on other programs with us. um, but
Oh
to
gosh.
your point, we have one testimony. I'm not sure if you have it in order with a female
Mhm.
that is well known in the community as well, and she did
Yes,
one of the health checks and was kind enough to give us a testimonial. So I think based on what you were saying
absolutely.
in regards to all of the offerings for females, I think it would be great if we could play her testimonial now as well.
Absolutely, folks. So here's Catherine Tyson, who has had her executive checkup, and here's what she had to say.
I'm Catherine Tyson. I've had the executive health check at Health City, and it was an amazing experience. There was no question when I got there, what the day was going to look like, what kind of test I was going to take and how long the process would be. They even had a lunch ticket or a breakfast ticket or something. So it was just, it just was completely organized and it just went seamlessly. Health is your wealth. So I would tell anybody, go do it.
Some good advice there. Health is your wealth. And absolutely, folks, you can't do anything else without good health. So make sure that you make it a priority. So of course, we just had someone inquiring about the contact details, again, for Health City, because they definitely want to get their exam booked. So it's 640-4040 is telephone number. And of course, you can email them at appointments@healthcity.ky as well.
And info@healthcity.ky if you have any questions, health check wise or otherwise. Info@healthcity.ky. You can send any question you have, and we'll answer you within the hour, and if not within the hour, typically within 2 hours.
Beautiful. All right, folks. So we're joined here today, in case you're just joining the program, with Shamari Scott. And Shamari is going through all of the various types of executive health checks that are available. There's several packages, and you can pick a base package and then add on to that, depending on, if you have any specific concerns or a family history that would make you want to pause in a particular area. So, for example, they have a diabetic screening option for only $43 that you can bolt on. They have respiratory screening, and they've got a pelvic screening for women. So Catherine was just sharing how she went and had a wonderful experience there at Health City. There's a bone health screen, which I think for a lot of women in particular, of a particular age, as we as we get into our 50s and sort of into the senior years, of course, your bone health is extremely important. You want to get an idea of where you're at with your vitamin D levels, everything from rheumatoid arthritis factors, x-rays if they're needed, and bone density checks and so on. So some really good options as it relates to that as well. So tumor markers, again, priced very, very reasonably at only $170 as a package add-on option. The one that always kind of scares me a little bit is a treadmill test, because that really makes me know, Shamari, how out of shape I am.
No, man,
Oh God, when I
it's
get on
you
the
just
treadmill
have
and I
to.
start huffing and puffing, I'm like, oh God. And I
That's
always
what
sit
it's
there
supposed to
thinking,
do. Even the very fit people, you need to get them to where they huff and puff so that
I
you can
know.
see what's going on. So
I'm always
everybody
like,
huffs and
man,
puffs
this
on it.
this position
Everybody
is
huffs
like,
and puffs, so not an issue. Not an issue, not an issue. But now
I'm
that we're
always
discussing it,
thinking, yes.
have you done an executive health check
I
as of yet?
have not done one. Um, I don't think I have. I've been there for sort of, I was having a
So we
little
will
bit of
discuss
a
that.
specific concern.
Right, right.
And I ended up taking the treadmill testing in relation to that. But no, I haven't. So I think
I
I
think
need to
you'd be
get
a
it done.
perfect guinea pig, huh?
Yes, I believe so.
So that you could tell all of your
Yes.
listeners, how easy it
What
was.
it was, yes. So I kind of think when I'm looking at this, for me, given my age, because I'm now middle age, folks, so we got to be realistic about our risk, that I definitely want to do the cardiac executive health check, and I would add on, as a woman, probably the bone health screen, diabetic screening, because we do have a family history of diabetes in the family, and probably the pelvic exam for sure. That's just me. But of course, when I speak to the experts, they might say, well, Sandy, you want to do a few other things. So my father passed away of stomach cancer. And this is why you got to know a little bit about your family history, folks. There's no
Definitely.
shame in it. I know there was a time when, the C word was something that we didn't even want to say out loud, but you're able to protect yourself as well as educate yourself about these things if you're willing to speak to your physicians about them. So, of course, there is a history of cancer in my family, from siblings to, I've lost a sibling already to breast cancer. And then, she was in remission for a number of years. But, stomach cancer is considered very serious cancer, of course. And so just being cognizant and aware of all of these things by way of screening and early detection. And as Shamari said early in the program, early detection, without a doubt, especially when it comes to cancers, really saves lives. So I think, these are some amazing options that are available.
And
Mm,
Sandy, just to mention, prior to going to Health City, I raised my hand, typical Caribbean man. Unless it's
mhm.
falling off, I didn't want to go to the hospital or didn't want to go see a doctor, right?
Yes.
And just being in the hospital, you understand that if you catch it early, then
Yes.
that makes a world of difference. And what I had to start thinking about as you get older and as you have a family, that it's not only about you, right? It was
Mhm.
only going to impact you, then maybe fine, but it impacts your wife, significant other. If you have children, you have to think about the fact that you want to be around and you want to be as healthy as possible for your children, and you just due to your selfishness of not wanting to go to the doctor shouldn't
Mhm.
adversely impact your family moving forward. If God forbid there was something there that you didn't catch for many years
Mhm.
and it took a negative turn. So as the breadwinner or as somebody who contributes, both emotionally and obviously financially to households, we need to take care of ourselves. And this is that first step. And,
Mhm.
you may be scared, but however, when you go in and whatever there is, there's a team of people that are there to help you to ensure that you're your healthiest self and around for your family and friends for many years to come.
Mhm. Wonderful. All right. Jonathan says that we need to all eat more organic, but who can afford it? So many fruits and vegetables have so many GMOs in them. I'm not sure that has anything to do with cancer. Well, I think, Jonathan, eating as healthy as you can, pesticide free is the way to go. But you know what? you can incorporate a lot of things right in your own back garden. You don't have to go out and purchase everything. We have a garden thanks to Marlon and his green thumb. Definitely not my green thumb, but we have
So not only
some.
IT,
I know.
gardening as
I'm
well.
telling you, he's got a lot of skills.
All right.
But we have scallion and bok chow and regular lettuce, and I'm
Nice.
going to taste this morning after the
Uh-huh.
show. Now I know plantains are not the healthiest thing in the world, but we have our own plantain trees now, so I'm gonna get to
Oh
taste one of
yeah.
my own. Yeah,
How
yeah,
long did it
boy.
take for
So
for it to actually bear fruit?
they took a while because they have to grow.
Okay.
Like I remember when they were
Right.
just, yeah. So
Right.
it took a while.
Okay.
But they're
2 years.
bearing fruit now, boy, and that's the
There we
whole,
go. And
yeah, a
that's
whole
it.
lot of plantains on that on that
Gonna be
plantain.
bearing from here on out.
Oh my goodness, I'm so excited about that. So Jonathan, there are little things that we can do. Sometimes it's not the big, because the big changes can be overwhelming, even when you guys know about my plan to everybody keeps asking me, have you kicked off that 50 by 50? But this is the plan to lose 50 pounds by the time I hit 50. Got about a year
Okay.
and a half. So we can do it.
Okay.
But it has to be done in measurable, like small baby steps. And
Correct.
I think when you take that approach, life is just so much less overwhelming. When you think about, oh my God, GMOs and organic, and I can't afford it, and I got all these bills to pay, just do a little bit of something. So maybe you live in an apartment, for example, and you don't have a lot of outdoor space. You can actually do aquaponics, little segments in your kitchen. Like I've gone into people's homes and see them growing their own herbs right on the kitchen counter, and these little kits that you can get. So start small, and then Jonathan, see where you go from there. Perla, good morning. She says, welcome to Shamari. And by the way, there are a lot of beautiful local farmers that will offer you pesticide-free options. You can go to the farmers market. You can go out to the I'm forgetting their name right now, but the farm there, Beacon Farm in Frank Sound as well, and you can pick up fresh stuff. So Marshall says that I've known of men who have died of colon cancer because they thought that they were too much of a man to get the examination done. Wow, how sad is that? Yeah, I mean, don't be afraid of these things. Sometimes examinations are not the most comfortable things in the world, but as I say, it only lasts for a time, and the wealth of information that you get from it can really be life-saving. So just do it.
Definitely.
Diet consultation. This one sounds exciting, Shamari. One of the first things they'd probably say to me is to give up the plantain. So Chanel agrees with that. She says, just don't fry them. Well, listen, you guys know about these air fryers. Do you have an air fryer, Shamari?
I do not have an air fryer.
Well, I've been told I have one that's
Uh-huh.
been in the box for a while now. I haven't taken it
Okay.
out yet.
How does it
But
work?
I plan on using it. But I've heard that plantains actually taste really good in an air fryer. And
Okay.
the air fryer allows you to have your quote unquote fried foods without actually frying them in the
Oh,
traditional way. So they're not
okay.
taking up all the oil and stuff like that.
But you
So
still put oil in it though.
no, you actually use the air to make it crispy. It's like a convection type of
Oh, really?
method. Yes.
Well, I thought you had to still
So
put some level of oil in there. Oh, okay.
I
All right.
don't think so. I think it uses the air.
Oh,
That's the
well,
whole
you tell me because I love fried food too. So you let me know.
yes.
You let
Um
me know, and then I'll see if I should buy one.
Yep. So it's basically a convection oven for your countertop is essentially what it is. So I've got one and I've yet to try it out. But once I heard that plantains can be put in the air fryer, I was like, now it's becoming more
Now you know.
enticing for me to try it. So Ameria agrees that an air fryer is the best thing man has made. Wow. Forget computers, forget medical innovations. She's like,
Air
air
fryer is
fryers
it.
it.
That's right.
And Chantel agrees that it's wonderful, uses no oil at all.
Okay.
So, and
I gotta
plantain
check it out,
takes,
man.
yeah, Sydney confirms that plantain trees take about 9 months to be ready. Yeah, it's been a while because I kept harassing Marlon. I'm like, when am I going to get a plantain?
Typical wife. So
I
he
know.
planted a tree, and you're like, "Where's the fruit?"
Exactly. Jeff agrees. Thank you, Jeff Pucci. He says the air fryer is the best thing my wife has purchased, in the last number of years. Wow.
Wow.
So some
Okay.
real testimonials here.
I hope she didn't buy him other gifts for his birthday.
You know what, Shamari, I was just having a think about this. So, one of the things that we need to do for my 50 by 50 plan is we
Right.
definitely need to have a
need to
sit down with a
start.
dietitian.
You need to start
And
with the executive health check
yes,
to
well,
understand
yes,
exactly
my
what you need
numbers
to do.
first.
Right,
Yeah.
right. And that's where the dietitian can actually help you to
Hmm.
understand where you need to actually adjust and what more you need to do
Yes.
in order to, one, be healthier, but two, if you have a specific weight goal, they can also help you understand
Hmm.
the types of foods you need to do that will help you to burn more. That's
Right.
still healthy, of course.
Yes.
Yeah.
I wonder if she'll come in my kitchen and go grocery shopping with me because I,
Yeah,
I
maybe
need that level of,
let's make
let's
that a
make it
challenge,
happen.
and let's
Yeah.
make that happen. We can film it.
All right, sounds good.
Yeah.
So Jamila says the air fryer is life. Wow,
Hey,
we're missing out.
this air
Listen,
fryer.
we are missing out. So folks, start with the executive health check. But I'm glad to hear that a lot of
Yeah.
you. Rita also chimes in, says that I love my air fryer. You don't really need oil at all.
Okay.
So the air fryer is the number one kitchen appliance. Sounds like that's going to make your life healthier. But again, folks, there is this wonderful list of executive health checks that are available to you. So let's make a goal. I always try to do things like kind of around certain dates so that I remember to do them. Like I always do my mammogram in August because that's my birthday. And I'd be like, okay, this is
Right.
my birthday month. I'm gonna celebrate
So
my
you
birthday
know.
and do my mammogram. So folks, just pick a date. Doesn't really matter. Just pick a date and run with it in terms of making this an annual event. So I'm committed. I'm gonna do one.
Mhm.
Shamari, I'm making a
Yep.
commitment here
Yep.
this morning to get
I'm
my
noting it.
executive health check done. So let me look at some dates and let's get me in there and then have everything done and then yeah, I can talk about. I have a few little issues I definitely want to discuss as well. But yeah, that sounds good.
I'm googling and looking all these versions of air fryers to see what do they sell them on island, or you have to go
I have
overseas?
seen them at local
Okay.
retailers, so they're
All right.
definitely available on
Okay.
island.
Okay.
Yes, so
Perfect.
mhm. All right, so thank you, Jeff. Jeff is having a good laugh, I think, at your comment about the gift giving.
He
Um,
knows. He knows.
Anne is asking about how long does it take for the executive health check? So you go
So
in, is it like an
yeah.
all-day procedure,
So
or what are we
typically
talking
it would be around 4 hours,
about?
four to
Okay.
5 hours, just because obviously we have everything compressed in one area. So you're
Mhm,
able to get from one area to the other area quickly. And we schedule it. We have an executive health team. So we schedule
mhm,
it to ensure that you get your results same day, unless something happens where there's an emergency and the doctor has to leave, but then you'd get it by the next day. You'd still have to consult, but that's minimal that happens. For the most part, everybody would get the results the same day. And if you were to go to the US and have the same type of health check, typically it takes 2 days. So this is, another area of convenience, as well as the timing is another one of our USPs. And I need to Google it, Sandra, and do some research. But my understanding of executive health checks is obviously when you have Fortune 500 companies
mhm,
and your senior level executive VPs and presidents and CEOs are, to the company, worth X amount just based on their expertise. It made sense for you to ensure that these executives were healthy, because that
mhm.
impacts your stock prices, et cetera, et cetera. And here we are making sure that everybody can gain access to it, because it's the right thing to do, and it's important for us all to understand what our health looks like, and so that we can make the changes needed if necessary.
Mhm. So, folks, this is all about a path to really just your health evaluation journey to make sure, again, that you have all of this important information available to you because, as they say, knowledge is power. So the executive health checks is your road to longevity. And who doesn't want to live a long, fruitful life? El Ray, he commented early in the program. I think recently he shared that he is 50 plus and, he exercises, he eats well. And I was amazed actually that that's actually how old he was. I thought he was younger than that. But he looks fantastic and he takes care of himself. And although you might look at someone on the outside and they look good, that doesn't always give you a full indication of what's happening on the inside. And that's where the executive health checks, I think, can give you a much better perspective and a fuller picture of exactly where you are with your health. So make it a priority, my Caymanians and everybody else, to get your executive health check. Make it a routine examination, because as Caymanians always say, an ounce of prevention. Finish it for me, Shari. An
A
ounce of
pound is worth,
prevention.
yeah, it's worth a pound of cure, right? Something like that.
You definitely have to get ahead of these things. Is there anything else that we wanted to discuss in relation to the executive health checks this morning?
We broke up there for a second, Sandy. So not sure if you
Oh,
got my
my
answer.
apologies. No, I was just saying if there was anything else that we wanted to discuss this
Okay.
morning specific to
No,
the
no,
executive health
no,
checks.
that's it. That's it. I'm going to have to run shortly, but
Yes.
just want to say that obviously, your health is at the tip of your fingers. Just dial 640-4040 or type us at info@healthcity.ky, and we have our anniversary special executive health check 500 comprehensive executive health check for
Mhm.
500 US. And for those that have insurance, you'll be able to use your wellness benefit for the most part, so you're not paying out of pocket. And even if you need to pay out
Mhm.
of pocket, $500 investment is definitely something that's important to ensure you know your numbers, understand your health, and if there is something that is caught, it's more beneficial to be able to deal with it at this point in time versus waiting, which then cost goes up, as well as the disease issues become greater. And
Mhm.
worst case scenario, there could be loss of life, and or you would have to miss a lot of time at work and such. And that's
Mhm.
why we always want to take care of these things sooner than
Mhm.
later. So info@healthcity.ky or 640-4040.
Does the uh, anniversary special, do you get anything for any sort of discounted rate on the executive and the cardiac executive health check? Is that one on
So
special at all?
the cardiac executive health check, what we will do is that for the comprehensive, you would
Mhm.
pay the 500, and then
Right.
there'll just be a difference of about $200, and then you'll be able to do that one as well.
Okay, awesome. All
Yeah.
right, so some good deals, folks. Health City is celebrating their 8th anniversary, and these are wonderful pricing options for you to just be motivated to get it done now. Price is no concern. Contact your insurance company. It sounds like the majority of it would be covered by them in any event as part of your preventative health coverage, which is an annual, benefit that you get from even, I think, the most basic of insurance plans. So take advantage of that. Doctors are not there just because you're not feeling well, you're sick. They're there to help you live a better, fuller life, and preventative medicine is really the way to go. So, Shamari, Scott, thank you so much for
Thank you
joining
for
the
having me.
program today. Of course, Shamari is the Chief Business Officer at Health City Cayman Islands, and you can contact them again at 640-4040 or info@healthcity.ky in order to find out more details and to book your appointment. Shamari, thanks very much. Appreciate it.
Thank you.
All
Till
right.
next week.
Yes, have a good week. And he'll be back here next week. And, every single week, we're going to learn a little bit more about what Health City has to offer and talk to some of their experts. Each month represents a different area of concern, and we'll start to delve into some of these. So we do have, let me tell you what we're in the month of April. So April, in terms of health and awareness month, here's a great one. Stress Awareness Month is the month of April. We have International Cesarean Awareness Month. So those of you who've had babies by cesarean, by C-section, will know the life-saving option that can be for a lot of women who may not be able to deliver a baby any other way. It's also Parkinson's Awareness Month. So there's a lot of things going on in the month of April, and I think we can use the expertise at Health City to delve into some of these things. We have Bowel Cancer Awareness Month, IBS. If you don't know what IBS is, it's something that I actually suffer from myself. That is irritable bowel syndrome. And boy, I can give you a lot of tummy aches. So we can learn a little bit more about that. Perhaps we'll reach out to the experts there at Health City. It is also Parkinson's Awareness Week which is the 10th through the 16th. So pretty much we're in Parkinson's Awareness Week right now. And what else do we have for for the month of April? Stress awareness. Ooh, we all need a little bit of that. Yeah, so we can look at some of these throughout the month. We have, of course, Easter's coming up. Oh, here's a good one that's coming up from the 18th through the 22nd. National Stop Snoring Week. I think we will talk to Health City about that one because there could be a medical reason why you are snoring. Sometimes heavy snoring and sleep disturbances because of it is an actual threat to your health. And so it's not just that it's irritating and you hate to hear people snore. Some people are chronic snorers because there's something else going on health-wise. So I think that is coming up the 18th through the 22nd. So maybe we could tap into the resources there at Health City to find out more about that, because I do believe that they actually have a sleep, what's it called? A sleep facility where you can go there at night and they will make observations, based on what they see. So it's also Allergy Awareness Week coming up the week of April the 20th through the 25th. So lots of things, folks, going on in the month of April. And of course, it would be amiss of me not to say in the UK, for example, that it's National Pet Month. Isn't that beautiful? So April is actually National Pet Month as well. So we'll dig into a bit more of those health related awareness events that are happening throughout the month of April. Folks, a time check, 8:44 in the morning. Do give us a call at 936-2626 is the telephone number. You can join the conversation. Feel free to participate at any level. You've got something on your mind, then by all means, let's talk about it. Yeah. All right, so let me just see what else we've got by way of comments. So Jonathan is thinking about a little garden. He said he was going to try it, but then he stopped because of the iguanas. But now I got to worry about the fruit pirates always poaching people's fruit. Jonathan, there's always a million excuses not to do something, but do it anyway. Because believe me, like I said, you can have an indoor garden. You can do gardening on your back porch. I must say that the iguanas have been less frequent. However, because of COVID and the stop to the culling program, I have seen the emergence of iguanas a little bit more. Now, when you say the fruit pirates, I'm assuming that you're talking about the beautiful Cayman parrots. And, I was saying this to someone last week. I love Cayman parrots. To me, they're the most beautiful bird. And whenever I hear them, I'm outside and I hear them, I always look up to see how many are in the clan, because parrots are very social creatures. So they tend to travel in pairs of at least 2, if not more. And so, I see them flying around from one mango tree to the next. And we've got a mango tree. And listen, I'm like, if the parrots want to eat 1 or 2 mangoes, let them have it. But I'm also not a farmer. So, I have a very different perspective, I think, on parrots. It's not my livelihood. I don't rely on farming for a living. So I'm probably less bothered by the parrots, but they were here first. They were enjoying Mother Nature way before we were on the scene. So I'm like, let them enjoy a neezaberry or a mango or whatever it is that they love to eat. So Malachi says good morning to Perla. She says you have some serious food for thought, and thank you so much for caring and sharing. So she was saying about the health concerns about an air fryer. So as it relates to the microwave. So you know what? We can dig into this a little bit more, because on the one hand, Perla, you have to consider the concept that the air fryer is saving you, especially because we do like fried foods. It's saving your health in that regard. So you're not using oils. And those are the things that are more likely to kill you than a microwave, because I can tell you a microwave does not emit as much unhealthy waves as people actually think. But now that you brought it up, let's see how it compares to a regular oven. So we know that air fryers, so just having a quick look online, that it cuts calories by 70 to 80% and has a lot less fat. Okay, so cuts down on the healthy, harmful effects of cooking with oil. Let's see what else it says. So benefits and risks according to medical news today. So the air fryers have been all the rave for a minute. So Perla does ask a very interesting questions. So deep fried foods tend to contain a lot more fat than foods cooked in any other way. And a lot of y'all are deep frying foods, everything from plantain to God knows what else. So of course we know that the better method of cooking includes roasting and grilling to a certain extent, but even grilling foods can have a health concern or component if it's charred, like when you grill it, if it's actually charred. So I know a lot of Caymanians, Jamaicans, Caribbean people in general love to jerk food, right? And one of the concerns with anything, whether it's a steak or jerk chicken or whatever pork that you're putting on it, is the act of grilling, right? That dark charred stuff that comes up on it, that's actually carcinogenic. So that is cancer causing. And a lot of people don't know that. Some people live by grilling, like every meal, it's like grilling something. So you've got to be careful of that sort of thing, right? So here's the thing. You've got 100 grams of fried and battered chicken breast that contains 13.2 grams of fat compared to just 0.39 grams of fat if you do oven roasted chicken breasts instead. Of course, we're going to admit that for a lot of foods, they taste better when they're fried. So air fryers require a fraction of the oil, or if any at all, that deep fryers need. And so that makes it a much healthier option for you. All right. So in case you're wondering, air fryers actually work by circulating hot air around a food item to create the same crispness in traditional fried foods. And they accomplish this by removing high fat and high calorie oils from the cooking process. So for example, you could use maybe just 1 tablespoon of cooking oil rather than multiple cups, or you can actually produce a similar result with no oils at all. So air fryers are heated air that contains fine oil droplets to take the moisture out of the foods, and the result is that it makes them nice and crispy. And it goes on to say in this article that, like many other cooking methods, air frying triggers a chemical reaction called the Maillard effect that improves the color and flavor of air fried food. Okay. So it's definitely better than deep frying. It can promote weight loss. Here's something else that's interesting. Air fryers reduce the risk of toxic, oh God, this is a big word. Acrylamide formation, whatever that is. So it's so interesting that we're talking about, is it healthy? But you don't know what frying food actually does, because we've all grown so used to frying food, and here comes a newer technology and you become scared of it. But actually frying food can cause, now who really thought about this? We know that fried food is good for you, but let's break it down. Frying food in oil can cause dangerous compounds to develop, such as, this is a tricky word, so I'm going to do a little dictionary.com lookup. Y'all know I love to be able to pronounce a word. So let's see how this one is pronounced, because somehow I think I'm getting it wrong. Let's see. It is, let's see.
Acrylamide.
Acrylamide.
Or acrylamide.
So it's called acrylamide or acrylamide. I was totally off on that one.
Acrylamide.
So this
or acrylamide.
This is your word of the day, acrylamide. Acrylamide, acrylamide. So basically that's a colorless, odorless, toxic crystalline compound. All of you scientists out there, C3H5NO, soluble in water, alcohol, and acetone, used in the synthesis of polyacrylamide and other organic materials, such as textile fibers, in the processing of ore, and in the treatment of sewage. Say what? So when you fry food, that dangerous compound is developed. Wow. Who would have known? This compound forms in certain foods during high heat cooking methods, such as deep frying. Now, I think that Perla didn't intend for us to go this deep into the conversation, but this is why it's so good to educate yourselves, because you're thinking, ooh, air fryer versus frying food. We're used to frying food, but look at how frying food is so incredibly dangerous. No wonder it's killing us, because it's creating, chemical dangerous compounds that we didn't really think much about. So according to the International Agency for Research on Cancer, acrylamide has links to the development of certain cancers, including endometrial cancer, ovarian cancer, pancreatic cancer, breast cancer, and also, okay, hold on. There's another one we're going to need some help pronouncing. These medical terms can be so hard. All right, hold on. Let me get the correct pronunciation of this one. I want to say it's esophageal, but let me just double check.
Esophageal.
Esophageal, which is part of esophagus. But yes, esophageal cancers. So, folks, this is stuff that I certainly had no idea. Additional studies have actually linked it to a dietary, have also linked dietary, what did we say this word was again? Acrylamide and kidney, endometrial and ovarian cancers. So again, air frying will reduce the risk of having that particular compound in your food. And of course, we know that cutting down on deep fried foods, folks, also reduces all sorts of disease risk, heart disease included. Now, let's look at the adverse effects of air fryers. So let's look at it. Number one, air frying does not guarantee a healthy or healthful diet. So it's healthier food options than deep frying. Limited fried food intake altogether would benefit a person's health, but replacing a deep fried food with air fried food is no way a guarantee of a healthier diet. I mean, that makes sense, right? So again, if you sit down all day and eat air fried popcorn, shrimp, for example, that's still not incredibly healthy. So you still want to make sure that your diet is filled with vegetables, fruits, whole grains, and lean protein. Now, if you use the air fryer to augment the times that you would have a fried food in your plate, so, instead of frying my plantains, I'll air fry them, but I'm still getting lots of vegetable, fruits, whole grain, and lean protein. That really is the way to go. So it does say that although air fryers reduce the likelihood of the acrylamide formation, other potential harmful compounds still could form. However, it does note that not all air fryers run the risk of creating these compounds. And so this is where you probably need to have a look at the type of air fryer that you're actually purchasing. So here's the thing. If you're cooking meat at high heat, right? And this is why, again, any sort of dietitian or a nutritionist will tell you that the least amount or the less amount of meat that you eat, the better for you. Because anytime you cook meat at high heat, you are looking at producing certain compounds. And that is true whether you're air frying it, deep frying it, or probably even have it in the oven. So just cut back on the meats. So it's one way, I think, to add a little bit of health to the diet. So thank you, Perla, for bringing that up. I think that was a useful bit of information for our listeners to have access to. Big shout out to DJ Yo-Yo.
Hey Kayman, los saluda DJ Yo-Yo, The Energy, y estás escuchando The Cold Hard Truth con la voz del pueblo, Sandra Hill, todas las mañanas, 7:30 AM, only on Bobo, 89.1 FM.
All right, and if you do not hablo español, DJ Yo-Yo was just saying, tune in to Cayman's #1 talk show, The Cold Hard Truth. You've got it locked right here, so thank you guys so much. Perla, you're most welcome. She says the outside old time grill, some wood cooking and branches in the fire. So all of these things have some adverse effects, folks. Good morning to Miss Darlene. Miss Sue says use olive oil for cooking. in the oven or roasting. Evelyn confirms that certain grills are not good either. Do your research before purchasing these barbecue grills. Well, listen, any high heat method, which includes grilling your food, has some downsides when it comes to your health. So slow cooking, especially meats, is a much better option. So Evelyn says she uses her stovetop and her oven. She doesn't trust air fryers and microwaves. I eat straight out of the pitas. The pitas. I'm done cooking. Do you mean the pots? Even the types of pots that you're using, folks, can certainly make a difference in your health. But you know what is so funny? Can I tell y'all something? When I read comments like this, Evelyn says she used organic coconut oil. I think that these things are great and they're wonderful. But a lot of us, we sort of hyper focus on certain elements of, like, I'm not going to use this, I'm not going to use that. And then we're smokers. It's like, to me, I always look at somebody who's like, oh, I'm going to run and I'm going to do it. And you're a smoker. I'm like, okay, probably the one thing you should give up is cigarettes. That's like the one killer right there that you could probably add years of health and wellness to your life. So we all have our Achilles heels. For some of us, it's sweetness. We got a sweet tooth. We can't stay away from fried foods, and I think, you work on one little thing at a time and you'll get there. So Perla recommends always doing your research before purchasing something. Absolutely. Marshall says nothing is good for your health wise. Just try to eat healthy and do portion controls and exercise. I think that's the key. 936-2626, folks. What else is on your mind? So in tomorrow's discussion, we're going to be, I don't want to get into it today because it's quite a big discussion, in fact, but we are going to be discussing, the fight clubs in our schools. So make sure that you tune into that. And also don't forget, on tomorrow evening, we have Impact Wednesday with Premier Panton. So this is your opportunity to have direct access every other Wednesday to the Premier. And he's here to answer your questions and take your feedback about the PAC administration, who's coming up now on 1 year almost of being in office.
The Cold Hard Truth now has your Premier access with Premier Panton.
Hello everyone, this is Wayne Panton. Come and join me on Cayman Mall Road's Premier Access every other Wednesday at 7 p.m. for a frank and open Q&A session. I'm here to answer your questions about the issues that concern you the most. Tune in to YouTube and Facebook Live on Wednesday. We will see you there.
Full transparency, answering your questions, down to earth, accountable, and accessible to who matters. You. Don't miss Premier Access on the Cold Hard Truth, spilling the tea like no one else.
All right, so big shout out there to Premier Panton, who will be joining us tomorrow evening at 7 p.m. Make sure that you tune in. His first time coming here on Bobo 89.1 was 2 weeks ago, and it was quite a wonderful show. Lots of callers called into the program because, again, it's a way for the Premier to, he's often very, very busy, but I think he needs to have that direct connection to the people of the Cayman Islands where he can hear your concerns, hear your voice, and you can certainly ask him any question that you may have concerns about. So we get questions here all the time on the program. People sometimes call into the show, as well as they will message me off air. And one of the most interesting things that I got recently was a question about the needs assessment unit. And a big shout out to another listener who sends in a WhatsApp comment. They say an air fryer is not a microwave. An air fryer is basically a convection oven. No radiation is emitted at all. And that is correct. So the process is very, very different. Someone also says that they would like an air fryer and they can't afford one. If I had a debit card, maybe I could buy one from Amazon where it's cheaper. That's the reason I need a caretaker to help me with these things. Yes. So they want to know if they can call into the show. Absolutely. You can call in. And by the way, the 936 number, you can even call via WhatsApp on that number. So if you don't have any credit to call direct, you can make it a WhatsApp call as well. So definitely call in. Air fryers, I feel like they're pretty reasonably priced. So, you can get them at a lot of the local retailers. So we've got a bit of breaking news happening this morning, folks. I've got multiple people sending me this. Breaking news alert coming out of New York. 5 people have been shot. Unexploded devices found at the New York train station. Thank you. Big shout out to both Kevin and Paul, who are both sending this information almost simultaneously. So this is a developing story as we speak that is happening right now. So 5 people were shot Tuesday morning, that's this morning, at a subway station in Brooklyn, New York, law enforcement sources have said. Fire personnel responding to report to smoke at the 36th Street station in the Sunset Park neighborhood found multiple people shot and undetonated devices. Wow. New York City Fire Department spokesperson has said that the 13 people have been injured and no details on what those injuries entail yet. So according to multiple law enforcement sources briefed on the investigation, preliminary information indicated a suspect fled wearing a construction vest and a gas mask. And photos of the scene tending to bloody passengers lying on the floor of the station. Further details are not yet available. So that was one news story. Let's have a look at the other one. It's crazy. So this is also another one about a mass shooting, multiple victims shot at Brooklyn subway station, explosions heard, and then undetonated devices. So oh my God. So this isn't good. I'll show our online viewers some of it. Viewer discretion is definitely advised. And wow, this is crazy. So this is the carnage this morning at a subway shooting in New York City. Oh my gosh, it's horrific. Wow. All right, not quite sure what's going on there, but of course, folks, be mindful of the fact that, in the US, they have a lot of mass shootings. That's their thing that they're known for, which is really, really unfortunate. I don't even know. Don't know what to say. Okay, so I do have someone who's trying to call in, but they're actually calling the wrong number. All right, so let me try to send her the correct number here. All right, folks. Okay, 936-2626 is the correct number that you should be calling, folks, if you're trying to get onto the program. Yeah, so this is breaking news coming out of New York this morning. So we'll keep our friends and family members in New York in our thoughts and prayers for sure. And let's hope that there's been no loss of life. I do see a lot of the people based on those photos are sitting up. So hopefully they can get immediate medical attention. All right, we do have a caller who's joining us. So caller, good morning and welcome to the program.
Hi, good morning, Sandy.
Good morning, how are you?
Hello? Hey, not too good. Is Shamari still there?
Oh no, he's left already.
Oh, I want to catch him because the last time the doctor was on, I gave you my number. I guess you were so busy that you didn't get to have him call me, and because I am such a bad state right now, but I wish you would call me right now because I'm so contemplating. I was trying to go back to GP, but I don't really want to go back there. I'm just sick of all of this stupidness. So I need, if they would call me, because I'm about to soon call 911. So if you just call me, and try to help me as much as they can, because I'm getting my pain help from my doctors at the hospital. She's great. They're great. The ACU or the AWO, they're great. They're good. And certain the oils and so on helps a little bit with the with the low to medium pains and so on. But I've got so much complications, and one is fighting against the other, and I'm not getting the help and support that I think I truly need. So I was wondering if you could have them call me as much as I can. As they, if you forgive me now if you hear a lot of noise, hollering, screaming, blank out. Sorry. This is why I don't call in one day, because I don't know what state my body will go in a second. It could be good in a second, it could be bad. You know, I deal with fibromyalgia, and this Raynaud's is crazy. I think I have it all over my body. And I have, so they say plantar fasciitis. My brain is, it feels like fire ants, right? And my neurons are firing off in my body. Sorry.
You sound like you're in a lot of pain.
Yes, this is pretty much 90% of my life. So people, I know, I have to laugh. I dance it off because I enjoy dancing, or sing it off or something. As soon as you can control it. A lot of the medications, they don't work. And I blank out. Sometimes I blank out. You have to bring me back in. Please to bring me back in to remind myself I'm talking about, because I forget.
I'm so sorry to hear that.
Sorry. But breathe. People can have patience with me. I'm very difficult. Very difficult. I hear a ringing in my head. What is that ringing on your phone? That ringing in my head?
No, that's somebody else trying to call on the other phone. But I will send your contact details to Health City now as we're speaking. I was just doing that. And but if you are in urgent need, you definitely need to call 911.
I call if I feel a little strange pain, I'll try call them, but like the ambulance right at all. And I stay right behind the hospital, and that's why I stay close in case I got to go there. But I've been going there too long. Not too much help from there. They don't even call. They don't give you equipment. Like the medication's been there long. It's a lot. There's so much going on, but you just gotta be strong and try. So keep it up. I didn't come this far. I've been through a lot, so this ain't pretty much nothing new. But it's not about me. It's about helping others also. It's in the same position. We have a pool team of people that in pain with the pain society, or this Raynaud's and fibromyalgia. Most doctors, they pretend like they know, but they don't know. You go there just to pump you up medication. I ain't too much in the medication. I'd rather stay natural and do it, because they don't do nothing. I only take them pretty much. Most of them that I take is just because I had someone had surgery, and just to try to put me to sleep pretty much. I'm telling you the truth, 90% of the time. That's to put me to knock me out, so I won't have to deal with the pains and so on. Even sometimes the pain of life or something. That's my only thing. I need rest.
Yeah. Well, chronic. Yeah.
This is what we have to go through daily.
Yeah, Miss Vernita, I really sympathize with you because
okay, good.
Yeah, I think anyone who suffered with chronic pain, even for a short period of time, can sympathize with what it must be like having to live with this 24/7. So I think it's important for you to it's important for you to try to get a proper diagnosis. And sometimes medication is we have to rely on medication as much as we hate it. I've shared before, I have a little issue with my feet, and I don't like to take even an aspirin. But sometimes you got to do it. Sometimes you got to take something to kind of alleviate the pain. So I've sent your information on to Health City, but please, if you're feeling immediate distress, it's better to call 911 if you need their services.
Stop. All right, yeah. Balancing issues, falling down issues, like we
Yeah,
say,
well, make
foot
sure you stay sitting
issues.
down.
Thank God I lost some of the weight. Oh, that was so glad, but my diabetes is gone over. Thank God for that one now. But since losing the weight, and that's another issue too. A lot of botched surgeries. Oh, I'm tired.
Oh my goodness.
No, please, Evelyn, darling. Thank you very much, honey. Thanks all for the support. They can do the same thing. I supposed to go there, and I've been contemplating not to go, but if I have to go, it's not nothing to. I don't know what to tell you.
Well, thank you, Miss
And I
Vernita.
need
We're gonna.
another one I'm praying for. I'm giving a good caretaker. I had one before with this company, but this company, they won't run you around. They make you miss your appointment. A very important appointment. My Botox injections that I get for my face, they help. So I must say with my TMJ as you and the brain is on fry mode most of the time. Excuse me, I gotta repeat myself because I don't remember. I blank because I forget. What are we talking about again?
You were saying that you're looking for a good caretaker.
Oh yeah. I don't want some specific people. Yeah, I don't want to feel embarrassed when I deal with certain people. Remember, the people could send me once I could send them to Seneca to help me. Sorry.
All right.
I regret that I had one, but I can't deal with that service. It's not fair. I'll call me because I like I about if they about doing these things to people and making your life worse. It don't make no sense to have the young lady. Oh, she was great, but the company they were slack, especially the head nurse. I'm sorry, I'm tired of you all people trying to take advantage of sick people. So anyway, I'm going now because I kind of get more of a breathe now. Okay, thank you very much.
No problem.
People think that sometimes see they're not connected now with the rain now. I can't turn you off. You got to turn me off. See, I can't connect because of the rain. Pin.
It's okay.
Okay, so now.
All right, so we'll disconnect her. She said she was having some issues trying to disconnect the call. Listen, folks, the reality is that there's a lot of people who are living with chronic diseases and chronic pain every single day. And trust me, the days that you get up and you feel even 80% good, 90% good, it might be 100%, you have to be thankful. I try not to complain too much. I've got, for the last 2 days, I've actually, probably like 3 days now, I've actually had a headache. And I think I told you guys about this. When I had my daughter, I developed something called, it's like a nerve in the back of the neck called the, oh God, what's it called now? I can't remember the name of it. It'll come to me here in a second. But essentially, I think because of how I was sleeping post, C-section and trying to sleep on the sofa because I couldn't make it upstairs in my apartment, I pinched this nerve that runs the back of the neck. And it's called the occipital nerve. And, it's for literally the first 6 months post partum, I had a headache almost every single day. And I'm a person who doesn't have headaches normally, doesn't take medications in terms of anything. And I was worried about, is this, what is this? We always think the worst as human beings, like, oh my God, am I having a stroke? Is it, And I did at that time start a small dosage of blood pressure medication because I think there's the stress of everything was making, my daughter was a preemie, so she was in the NICU. I thought it was stress related. And then it kind of disappeared, but regular pain medication does not help. So you can take all the Tylenol you want or Advil, whatever. It's not going to help with this kind of pain. And so it came back a couple times. And eventually Dr. Sydney, by the way, said to me, I think you need to go see a neurologist. And I thought, oh God, here we go. Worst case scenario. And he said, no, we need to rule out what else this could be. So did an MRI that came back, thankfully, everything fine. But it turns out it's something called occipital neuralgia, which is basically this occipital nerve, which runs towards the back of the scalp, like back of the head, somehow got pinched. And the people who suffer from this occipital neuralgia, and it causes this headache that is a very uncomfortable headache that will just last forever. So massage does help. So if I massage like the back of my neck, I do realize that that helps. And then sometimes after a while it goes away. And the other recommendation that the physician said is I can actually go into him and they have an injection that they'll give you right in the back of your head. And I thought, oh my God, that just does not sound like the most pleasant thing ever. So I've never mustered up the courage, despite having headaches that might last a couple days. I've never really mustered up the courage to go and get the injection yet, because it just is like, that sounds pretty scary. I'm not that fond of needles. But what I have recognized is that a lot of times it is brought on, like how the original one was brought on, by pinching the nerve and how you sleep. So I have discovered that if I take my daughter, had a little toddler pillow, it's a little sheep. I need to order another one because I've been using her pillow. If I put that at the nape of my neck, in addition to like a regular pillow, it does seem to help quite a bit. So folks, I guess we do whatever we have to do to live with chronic pain. And that's not something that is there all the time. It kind of comes and goes sometimes. So I am having a little bit of an episode right now, but I kind of just, try to go through my days with it, and you guys know I've had tennis elbow, which I'm still dealing with at the moment. It's not as chronic as it was, but it's still a constant pain that's always there. In addition to some feet related issues. But still, I'm so thankful because, it doesn't seem to me that any of those things are as chronic as poor Miss Vernita and what she's having to go through. It just sounds absolutely horrible to be in such constant pain that it's even difficult for you to talk. And, oftentimes I check on her. She's one of my customers, and I know the struggles that she has. And so we're going to just keep her in our thoughts and prayers. But Miss Vernita, obviously, if you need medical attention, please call 911. Sometimes it is very, very difficult to get a proper diagnosis for some of the things that, our bodies are going through. And it might take you going to different physicians on island or even overseas to try to get some of these chronic issues under control. Jamila says, imagine I complain about bad period pains and I just can't imagine what she's going through. And Perla is sympathizing. She says, OMG, I pray she finds the help that she needs. It sounds serious. And Irvlin's suggesting again that if you need to call 911, please do so. And she's also praying that she never gets to that point. And the thing with life, folks, is honestly, you just never know what you're going to end up with. Everything from people suffer from really bad rheumatoid arthritis and other diseases. So that's why I tell you, folks, anytime people say to me, hey, how are you doing? I said, you know what? I have nothing to complain about. Not that I really don't, but I refuse to find anything to complain about. I got a roof over my head, food in the fridge, food on the pot and the stove. Happy family. Yes, a little bit of aches and pains, and sometimes you're struggling paying bills and whatever, but there's always somebody out there worse. So I'm just thankful. I'm not gonna obsess about the negative things. So Perla says people like her who live alone and have no access to phone or can call a neighbor. Please, Caymanians, look out for each other. If you need someone to talk to, she's always there. So she's saying Perla is available. Why don't we have a life alert system? I think it was somebody else was suggesting this the other day, but this would be very, very useful. And I don't know if any of the sort of emergency or security systems came out. I've never heard of it being offered here. It's very, very popular in the US, especially for elderly people. And a lot of elderly people do still live at home. It might be a choice, live alone. It might be a choice for them to do so. And sometimes it's not always a choice, but they might have caregivers that will come in and check on them. And in between that, they are struggling, and sometimes you can have a slip and fall or different little things happen where you need someone to be able to call 911 on your behalf. And are we aware does anyone know if anybody in Cayman offers any semblance of like a life alert system where you can walk around with the little emergency thing in your neck and you can press it if you get into any sort of trouble? Now, I know that sometimes it doesn't help. Sometimes you just die and that's it. You know, you don't even have time to press a button. And those are the you know, that's life really. But we're keeping an eye on this situation in New York. Someone says that they're launching a therapeutic elderly and diabetic care and home health system. There's actually quite a few out there. And so I would encourage Ms. Vernita that if she has found, if she's not found the right one, then, you know, she needs to continue to look. So another caller says that that lady seems to need urgent care. Ibuprofen 600 milligrams is great for foreigns. Kirk Market sells the tablets for $4, no prescription needed. So they're saying to get a prescription for 600 milligrams, but you can do 400 over the counter. So some of the local pharmacies require, you know, a prescription for the higher milligram tablets. But you could do 2 400 milligram tablets. Now, be very, very careful with things like ibuprofen, folks, because there is a link between these types of painkillers and actually heart attacks, believe it or not. So this is a proven link between painkillers, especially ibuprofens, and heart attack. That's one of the reasons why I try not to take them if I can help it. But at the moment, I sympathize with Ms. Vernita because I've been having to take, it doesn't really help with the occipital neuralgia, but with my foot pain, I'm actually having to take about 1,000 milligrams just to kind of keep my foot discomfort under control. But, you know, I try to do other things and just popping a pill, because for me, popping a pill is always the last resort if possible. So I do, you know, foot massage. I have 2 machines actually that I try to use as often as possible, because I do know that that can actually help as well. And wearing the right types of shoes, wearing shoe inserts, all these things. And guess what? You know how we're talking about the 50 by 50 plan? Losing those 50 pounds would undoubtedly help as well. And that's why I've got to make it a priority. So yes, non-steroidal anti-inflammatory drugs, medications commonly used to treat pain and inflammation, can increase the risk of a heart attack, stroke, and high blood pressure. And so you've got to be very, very mindful if you're taking them, that you know that there is an increased risk, and it's prolonged, obviously, the longer period of time that you are actually taking those as well. So this is research that we know now for a couple of years. There's been some well documented studies to prove that that is the case. So thank you guys so much. Oh, somebody else is saying that they need me to collect some gift certificates for the young man. I did give him one over the weekend, by the way. And we are continuing to offer him some assistance, him and his girls. This is a young man with 3 girls. So thank you guys who continue to reach out. And I did mention that on Thursday of this week, I'm having a planning meeting to hopefully sort out some permanent assistance for him. But a lot of people have really stepped up to the plate to assist. So this morning, after the show, I will be going to a special event at the airport. So if you get an opportunity to tune in on the live stream, I think I might live stream it. Just keep an eye out for the Facebook Live, because there is an event that is going on at the airport this morning. It's going to be, I'm not going to tell you anything more about it because you got to tune in to find out exactly what it is. All right, folks, 936-2626, Cayman's #1 talk show.
The Cold Hard Truth is Cayman's #1 talk show since it debuted in March 2020. According to independent research, we are the most listened to talk show in 2021, and most people prefer us to any other options on island. We tackle tough issues some days, and other times have fun and lighthearted discussions. But most importantly, the Cold Hard Truth is here for you. Thank you for your support as we continue to be the voice of the people in 2022 and beyond.
FM is the radio station that you can certainly catch the morning show on. Of course, we're also live on YouTube and Facebook, simulcasting on those various platforms as well. About 3 minutes left in the program, so let's just read any more comments that you have. So Sue says, so do I. All of this is for my foot problem. Neurologist is next. Yeah, foot problems can be, oh my goodness. You know, the crazy thing is we don't recognize how much we use our feet. I feel like it carries your entire body, your body weight all day long, pretty much. Sometimes you've got to sit down and put your feet up and literally just take a break. But yes, you know, when I get up in the mornings to do this show, I think to myself, right, I've been sleeping, lying in a position all night. The last thing I want to do is sit in the mornings. And sitting is one of the health risks, our sedentary lifestyle that has contributed to us, you know, gaining weight and just not being in optimal health. And so 99% of the shows that I do are done standing. We do have a caller joining us from overseas. Let's see. Good morning, caller, and welcome to the program.
Hi, Sandy. I know this is a little bit off topic, but I have a quick question.
Absolutely.
In regards to quarantine. What if vaccination? What if a couple went through a divorce and the mother wants the kids who are over 12 to be vaccinated and the father doesn't? What support is there? Because, for example, if the children are overseas and they need to come home, what support and what can be done? Because the father is saying no, mother is saying yes, and the mother is vaccinated. So that's a sticky situation.
Wow. Let me have a think about this. Can I try to answer this question tomorrow for you? Because I'm going to speak
Yes, please, because because let's say, for example, mother is overseas with 2 unvaccinated children. Mother needs to come home. Father doesn't want them vaccinated. And it creates a big problem, because I know there's a law that's passed that kids under 12 takes the status of the parent. But what about kids over 12 who's in a divorce situation where both parents cannot see eye to eye?
And how old are the kids, just for clarity? How old are we talking
They're
about?
one is 14 and one is 15.
Okay.
So the mother is now stuck in a situation where she can't travel, or she travels back, she can't come home. If she wants to come home, she can't, because now she has to quarantine for 1 week and she's vaccinated. The father is working. He made the decision. He doesn't want them vaccinated, and then he doesn't want to quarantine with them. He can't help her in no way. So I need to know what is the solution to this issue, because you know, the mother who's overseas needs to come home.
All right, let me speak to a few experts, and I'll try to get you an answer tomorrow morning.
Okay, so you can save my number?
Yes, please.
Okay, thank you so
All
much,
right.
Sandy.
Thanks,
All right.
too.
Bye-bye.
All right, so very, very interesting question. I'm having a think about it already, but we are at the point where we need to end the show for the radio audience. So, of course, thank you, folks, for listening to 89.1. I'm going to speak to a couple lawyers, speak to a couple community leaders, and see what they think about this situation. So tune in tomorrow morning, and we'll talk about it. This is a tough one. Very, very difficult. But thank you guys so much for tuning in, folks, and have a beautiful day.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.